Hey everyone, I didn't just give the grand test 6, I gave the grand test at 9 today, and it's now 4:25 p.m. and I am back after a little break because I always require a break after a grand test. We have a score of 490 out of 800, 92nd percentile, which is okay, I guess, and 135 correct. I had to skip a lot in this exam. I felt this exam was quite tough. Not as tough as the previous one, actually, but quite tough. And I had to skip this much mostly because I had memory issues this time. I am realizing that I have forgotten a lot of the previous things that I had done a month or more back. So, this was the reason of so many skips. I had wanted a score above 140, but we'll take this also. I guess any progress is progress only. So, let's see what's the uh, analysis of the test. Okay, 30 seconds, good guessing, 76 guessed, 45 correct, 26 answer changed, 17 correct. Oh, that's nice. So, out of the total, pathology is the highest, which shouldn't be a surprise because I did patho the most recently. Then pharma. Okay, pharma, I didn't expect to do so well. Forensic, ENT also I have done recently. Medicine, finally, such a high score. I always get very low marks in medicine. Psychiatry, biochemistry. Biochemistry also, like I have done recently, so I'll take it with a pinch of salt. Surgery, pedia, ortho, anatomy. On anatomy, constantly I get such low marks. My God, I don't know what to do. Uh, Obs gynae, anesthesia, commed, physio, derma, micro, radio, ophthal. Oh, ophthal is the lowest. Okay, I got a brush up on my ophthal then. Radio, always I get very poor scores. Micro, I don't know why such poor scores. Like micro, derma, I know I am good at these and still I get very poor scores in these every single time. I have seen that. And commed, also I got to expand on all my theoretical portion because like the questions they are asking in commed aren't very bizarre questions. These are normal questions just not present in my notes, so I am not able to answer them. Okay, so I'm gonna start the GT review. And for the topics that we had decided for today, okay, so I gave the GT. I'll be doing the GT review right now. After that, I'll do the previous year questions and surgery, patho, and obs gynae revision is left. Out of the backlogs for the day before yesterday, I could do around 18 pages of surgery, and hopefully, I'll be able to complete surgery today. And the backlog will be completed in 3 to 4 days if I allot 20 pages per day. So, yeah, I am comfortable with that. Uh, yeah, so reviewing my answers. Also, I faced a lot of technical difficulty in the exam. I don't know if somebody else also faced the same difficulties, but my images just wouldn't load in the second section. Like there were a lot of image-based questions in that one, and I had to wait like 30 to 60 seconds for the image to load itself, and that took up a lot of time. Like in that section, there were a lot of questions I think I would have gotten correct if the image had loaded faster. I would have gotten them correct because at the end I had very little time to see all the questions that I had marked for review and I had to hurry up in that section. But bygones be bygones. In the main exam also we don't know what will happen because like in the last exam my computer shut down in both the PG and INI exams. So yeah, we don't know what's gonna happen. So this is just practice. Okay, question review. Spinophenolate was correct. Benzoquinone acetate, 30 ppm. Okay, glaucoma. I was kinda. I thought it was glaucoma. I still didn't mark it. I don't know why. Bayoneting sign. I was thinking hypertension. Glaucoma also, of course. Okay, this question. This question I always do wrong. This ASA classification, I just learned it 3 days ago, and I thought that this was grade 4. Like, one is no limitation, two is mild limitation. So I remember hypertension, diabetes. Three is severe limitation, and in Marrow it was CKD, CLD. And four is like it is a threat to life. So I thought this was angina, so this should be a threat to life. That's why I marked this opinion. So according to this, a patient with poorly controlled hypertension with CAD more than 3 months falls against AC grade 3. Okay, so what are they giving as grade 4? I marked it as grade 4. Okay, so if the CAD was less than 3 months, it should have been grade 4. Okay, I marked this wrong. No problem with that. And so this is the first BTR END I will be attending. I probably won't give the test. I'll just attend the explanation directly, because like I don't know whether I'll be able to do all the ENDs of cerebellum, but the Zena Vora ones I definitely want to do if I have time right now. Like 2 months are left, so as much as I can do, I will do the ENDs. Okay, guys, post your scores in the GT. How did you find it? And any suggestions to take my score up even further? And yeah, I'll see you later then. Gradually giving these GTs, I have realized that I don't need to increase my theoretical knowledge now. I need to just stay calm during the exam, because in this exam, what I did differently was reading each question quite carefully and revisiting each question twice. Even if I was sure of the answers, that's why I changed a lot of answers, because what I read in the first go was something wrong, and when I read it again, I realized the mistake and I marked the correct answer. And yeah, that is what giving exams has taught me, just to be more calm and stable during these GTs.